Welcome to Own Your Heart Health. I'm Dr. Regina Druz, your holistic cardiologist. This week, we will dive into common heart health concerns, uncovering root causes, and unpacking scientific discoveries and controversies. The information provided does not constitute medical advice. Please contact your healthcare practitioner before making any changes that may impact your health. Welcome everyone today. I am really excited for this episode because in this episode, I'm joined by a colleague, Dr. Maria Sokolina. Now, Dr. Sokolina is a very special kind of a doctor. Not only is she a dentist, but she is a dentist who well understands oral systemic connection, the impact of sleep disordered breathing that very often dentists are the first group of people to encounter, and how it relates to overall health. And of course, being a cardiologist, we talk a lot with our patients in cardiology about oral systemic connection and how to help our patients to optimize their health by very often starting from sort of, the very beginning, right? The mouth and everything that's in the mouth. So Dr. Maria, welcome to Own Your Heart Health podcast.
Thank you very much. I'm so honored to be here.
Awesome. And I ask everyone, all of my guests ask the same question to begin with, and it is, how did you grow up to be who you are today? Tell us your story. How did you become a dentist? How your interest evolved, and and sort of what are you doing right now in your practice to help patients that come to see you?
Thank you. That's a great question for me to become closer to your audience. So according to my accent, I was born in St. Petersburg, Russia. And my grandma, she was a doctor. She was a medical doctor, but unfortunately we never met. She died from heart attack when my father was 17. So I only heard what she was a doctor, and I was named in her honor.
All right.
She was a doctor during World War II. She was actually specializing in tuberculosis that time. It was really popular.
So infectious disease. She was an infectious disease
doctor, but during the World War II, she was a doctor who treat everything. She was on that military train. So when she passed away, she left a lab coat and actually a hat, the medical hat. And my father kept it, somewhere, and I look at that, but I don't know how, world is full of coincidence. The human body always fascinate me. But as being Jewish in Russia, my parents didn't think I ever gonna make it to medical school. And I actually, it was one event. I had an accident. I had a rupture of the ovary during the school year, the trip, and I ended up in a Russian hospital. And being in that environment with the leaking ceiling and lack of medications and, those very special spring bed would make that sound. And, just like it was quite depressing. And I was thinking, okay, now that's going to be my life. If I'm going to choose the field, it's going to be my life. And I met a doctor there, young intern, who said, I'm going to show you the morgue. If you can, be okay with the dead people.
He wanted to impress you,
He wanted to impress me.
Like a young, pretty girl and wanted to impress you.
So, we visit the morgue, and I look at the cadavers and, I didn't have much of a, fear or emotions. I thought, that's okay. But that idea, what I'm going to keep going to, try to pass and not get to medical school, that kind of shake my confidence. And I didn't have a lot of it. So I start with engineering school. But as soon as I pass my test, I realized that I definitely don't want to do it.
You're not a technique.
No, not even technique. Like being in the hospital, I look back and that depressing hospital actually look appealing. It was, kind of a test. It was a positive thing. So following year, I got into medical school, but on the dental department. And the reason why I become a dentist, there are kind of two things. I was a dental patient for 10 years. Due to orthodontics, my mom wanted to see me beautiful. So she started myofunctional therapy. and tongue tie release when I was 4. And I was in ortho, Russian ortho look very different for 10 years. So I had a plaster impression and acrylic expanders, and they tried to expand my jaw. What I analyze now, they doing the same thing, what I'm doing now for my patients to help them breathe better. But I met it, like it meant to be.
But you were treated like, I remember those treatments, and it's interesting that you're mentioning that, because I was also in a hospital when I was a young girl. I had glomerulonephritis. And what's also interesting is that you and I are both coming from a family where we had a female role model who was a physician. So for me, it was my aunt, and she was much older than my father. And she was actually an obstetrician gynecologist. And her daughter, my cousin, was an obstetrician gynecologist too. So when I went into cardiology, they were completely beside themselves. They said, "What are you doing? This is not a specialty for a woman." And I said, "What are you talking about? You're in a surgical specialty that has all sorts of crazy hours and, huge demands." And that what's interesting is that, I was very inspired by how, despite tremendous egregious transgressions in back then Soviet medicine, because you and I are basically, that was the Soviet medicine. And at that time, it absolutely dehumanized patients and, and was actually abusive towards some patients, like patients, for example, who were politically inclined against the government. It made them, psychiatric prisoners. So this is a totally separate discussion. But, but I was so inspired by my aunt, because I think she really embodied all these qualities of a physician, and her strength and her authenticity, and how she was able to help so many women despite the system taking on some personal risk was actually tremendous. And she even worked at that time, we're talking like 1960s, Soviet government at that time had some connection, I guess, or participation with other countries for medical services. In particular country where she was sent was actually Afghanistan. And she was the only white person technically in that region. They have never seen a white person. She was tall. She played actually basketball on the university team. And she walked with a convoy from village to village to deliver babies and to save the moms, because moms really didn't have any obstetrical care rather than, let's say, local midwife. And, she saved a lot of women and a lot of babies, and, was a huge role model for me. So, so this is interesting. So tell me right now, Dr. Maria, what is, in dentistry, we hear a lot, as medical doctors, we hear a lot that we need to pay attention to oral systemic connection. What is oral systemic connection, and what do dentists think about it? Tell us.
I'm so appreciative what you asking the question, because I devote my life to educate medical doctors what actually we are part of medicine. We're not like those medieval, terrorists with the chisel and the drill, but we actually see a lot. And it's so special for dentists, because it's a common knowledge. Like certain things it's easy to work with, what's a common knowledge. So common knowledge you have, if you want to chew with your teeth, if you don't want to have a toothache in the most unexpected situation on your vacation or whatever, you have to visit the dentist. So I don't have to explain that to people know that. And nobody likes, it's kind of antisocial if your teeth are full of tartar. So people visit the dentist. It's not too far from having a haircut.
You mean so wasn't initially, like in the olden ages, your barber was your dentist, right? They would, like pull your teeth and at the same time give you a haircut, something like that.
Something like that. So that idea, what you have to visit the dentist, didn't change much. But the fact what dentist can be actually your guard, and the first one who gonna see the signs or something going to the other direction, that knowledge are not common.
Interesting. So, what are the signs as a dentist, right? When, let's say, a patient comes in, and as you mentioned, they may be coming in just for a cleaning or maybe some cosmetic work. What are the signs that you look for to give a patient an understanding if this oral systemic connection is in play in that, for them specifically?
I want to talk about several things, but I want to mention oral cancer. I want to mention that. So as a dentist and as a patient, you have to visit the dentist if you don't want that deadly disease to go south. So that's not related so much to systemic connection, but it can affect you systemically. So that's number one.
That's very important, actually. And, it's important that you're saying this because my husband is also a dentist. And, a few things that I hear now and then is how young people who are otherwise healthy are found to have these early oral and sometimes tongue cancers. And,
exactly.
Obviously we're seeing a good friend of mine is an oncologist that specifically works with gastric and colorectal cancers. And I think they are alarmed in the oncology community at the increased incidence of the gastrointestinal cancers in younger patients. Yeah. And, of course, our oral cavity, our mouth is the entry point into the gastrointestinal system. Exactly.
Beginning. And then I want to jump into microbiome. So when, we discuss the novelty, I would say, what salivary test can be taken, and certain bacteria, what found in the mouth, also have a relation to colorectal cancer. So really? By visiting a dentist and asking for saliva test, you can be alarmed or be advised to have colonoscopy early on due to the high concentration of certain bacteria.
Hi everyone, it's Dr. Regina here. I know there are contradictory opinions about nutrition for heart health and longevity, and discussion often gets heated and confusing. There are those who push for low fat, low cholesterol, and then there are fans of a ketogenic diet. There are many anti-meat voices as well, suggesting vegan or vegetarian style of eating. With all the chatter out there on what and how to eat, my team and I decided to create a tool for patients, medical professionals to clear the clutter. It is called Holistic Heart University, and it provides on-demand courses, nutrition and lifestyle resources, information on supplements to make it easier to understand how to make healthy choices for your heart. I'm especially proud of our open office hours for program patients and the Q&A feature where you get to ask your individual questions and put us in the hot seat. Head out to the show notes for the link and use my special promo code to get a huge 20% off on our annual health and wellness subscription. The code is owner20, and I'll see you in the office hours.
So can you expand on it a little bit? First of all, what kind of oral microbiome testing patients may get? Because I know, for example, there are some companies that do direct to consumer oral microbiome testing, and there are other companies that preferentially offer this test in a professional setting. So what kind of tests there are, and what is that specific bacteria that we may have to take a look at in order to understand if there is a higher risk potentially of colorectal cancers?
I'm going to give you exact name of that bacteria because they are always, it's a Fusobacterium animalis. I have a very hard time with the bacteria name. So it's Fusobacterium animalis. And if I see the high concentration of that bacteria. Yeah. So regarding the salivary testing directly to consumer, I think those testing, they're quite simple. And I actually have a friend who make those tests and people can do the saliva test. They test usually 5 different things to direct the patient to the dentist to have a certain therapy. We do, obviously we're a dental office, we do the professional testing. I usually use Simply Perio. It's because it's a simple test and I can have results quite fast and discuss it with the patient. So in that test, if we want to talk about the test, we have number one, we want to have a composition of bacteria what cause periodontal disease.
Periodontal disease, oral microbiome as it relates to periodontal
disease, okay. But not only. But I'll start with that. So we divide bacteria into several groups, and they usually on that test go by colors. So it can be purple and red. And red bacteria is Porphyromonas gingivalis. Right now, that's the deadliest bacteria, I would say, related to periodontal disease because it was found, but not bacteria itself, but toxin from that bacteria can cross border in the brain and lead to Alzheimer.
So what is the name of this bacteria again? I know.
Porphyromonas gingivalis.
Porphyromonas gingivalis. So Porphyromonas gingivalis is capable of making our blood-brain barrier leaky, which of course,
it's not like that. It's a reaction. It's an immune reaction. Immune reaction to specific toxin this bacteria is producing. And I actually, just like you, I do have my channel and I put the dress on the top and I send you the, I hope your audience would like to dig deeper, and I interview Dr. Edward Zuckerberg, father of Mark Zuckerberg, who is heavily involved into two salivary testing. One for oral cancer, the one what we discussed earlier, so people can find out before it's actually appear in the mouth based on saliva test. They can find if they have any, in situ, we call it, any early stage of oral cancer and address it as well. So it's one salivary testing, what he was talking on our interview about. And the second one is antibodies to toxin what produced by Porphyromonas gingivalis for people who don't want to have Alzheimer's disease.
So how would you say you mentioned simply perio, and I'm familiar with that test. It's been sort of mentioned in a number of professional settings, but the test doesn't determine antibodies to Porphyromonas gingivalis.
No. Only bacteria found. Yeah, because we assume if we can reduce that count or eliminate this specific bacteria from the gums, based on, different type of treatment, which I'm happy to talk about, then risk of developing Alzheimer's disease later on or atherosclerosis as well would be reduced.
Interesting. And so does the test Simply Perio also shows the presence of this Fusobacterium animalis?
Absolutely. Yes, it's a Fusobacterium animalis. And also I want to talk about other two bacteria that are also close to my heart, called Fusobacterium nucleatum and Tanerella forsythia. Those two lovely bacteria.
You pronounce it so musically. I love hearing you pronouncing those names. It's a lot of...
Yeah. So those two bacteria actually indicate possible presence of sleep apnea and acid reflux. And those are specific disease. Signs of those I see very often in a patient mouth. But to make my words not just words, but actually to have a scientific support, this salivary test helped me to convince patients to go further, to visit gastroenterologist for possible acid reflux, or another one, laryngopharyngeal reflux, LFP, or to have a sleep study for possible sleep apnea. And I can give a simple explanation to your audience, but I think the presence of both bacteria related to mouth breathing
Interesting. So when a patient comes up with these results, right, there are certain things that you can obviously do from a dental perspective if they have,
Absolutely.
right? If they have gingivitis, you have to treat gingivitis, you have to establish dental hygiene. But this is a great, I think I love how you connected so many systemic diseases to just a fairly simple test that people can get in a dentist office to really give them that initial understanding if they need to dig deeper, right? I think so often, especially when it comes, for example, in my practice at the holistic card centers, we routinely do genetic testing, and we do a lot of genetic testing. Some of it is more specific, let's say, to lipid pathways or nutritional genetics or to Alzheimer's disease pathways. Some of it is a little bit more involved because it looks at oxidative stress and what immune system is doing. But before one even goes into that genetic testing, you really need to understand what is the situation now, right? Because individuals with gingivitis or bacteria that are related potentially to atherosclerosis or increased incidence of cancer, this is treatable.
This is treatable, and I would say in a very simple way, comparing to a lot of treatments what patients have to undergo if they let it go. And I usually explain that, but the mouth, it's not only open physically, but actually the gum is the entrance.
Right. And it's interesting because in the medical literature, it's always mentioned, for example, that patients that have poor dentition or patients that have trouble chewing, right? We know that chewing, for example, is related to secretion of brain-derived neurotrophic factor or BDNF. And so those patients, for example, sometimes they're older or they just have bad teeth and they're unable to chew. There are a bunch of things happen. They may have lower BDNF secretion, which of course is required to maintain your neurons. They may actually also be depriving themselves from digesting or activating nitric oxide precursors that come from food. And so but seems like this connection is even deeper because it's not just about having teeth and chewing. It's about what is the reason that their dentition may not be great. And like you said, it's the gum, it's the oral microbiome, and that are giving them these outcomes, and sort of everything else follows. Absolutely fascinating. So what would you say, let's switch gears a tiny bit. When you see these bacteria, when you test the oral microbiome, and then you send patients potentially for further evaluations, what have you seen with regard to sleep apnea? What kind of tests are available? And, where do you find, how patients can benefit from a dental intervention if they're diagnosed with sleep apnea?
Number one, I cannot diagnose anyone with sleep apnea, but I can advise and direct them to proper routes. And I want to mention a little bit longer about sleep apnea because bacteria is not the only error or indication for patient have a sleep apnea. If patient clench and grind, if patient wake up with a headache, and sometimes headache can be muscle origin from temporalis muscle or masseter muscle, which shows what they clench or grind at night. If patient wake up with a dry mouth, and actually on the gum, we can see the dry mouth. We can see signs of mouth breathing. And also my favorite is the bone growth. A lot of patients come with the bone banks on a lower side next to the premolars or in the middle of the palate. They have like a fruit hanging
So
from the
you
middle.
find this on the X-ray, or you find this on
You
visual examination?
You see it. It's like jumping into you.
Wow.
Yeah. So you don't need. Yes. I see the signs, and and I discuss. What this or that. So I usually can predict someone who suffered from sleep apnea, and then I ask questions about snoring and about stuffy nose and about sinus infection. And I look at the tonsils. Dentists can see the tonsils. Dentists can see the crowded airway. Dentists can see the tongue. which is a
Right.
very important organ, and we don't pay much attention to that organ. But it's actually the organ that stimulates parasympathetic nervous system. So
Okay,
very
so
important.
tell us about that. What should we be doing with our tongue or not doing?
Our tongue have to stay on the roof of the mouth most of the time. In the beginning of our life, that's actually stimulator of growth. And during our life, it's actually touching the roof of the mouth where the sphenoid bone located. Like, I don't want to go deep into anatomy, but underneath there is that sphenoid bone, that's magical bone, what look like a bat, what a lot of nerves passing through, and including the vagus nerve. So touching the, keeping the tongue there, it's not only open up the airway, which is very important factor for sleep apnea, and it should stay like, let's say, in a suction, because it has negative charge, and all other tissues, instead of flapping around into the airway, have to kind of get physically drawn to the tongue.
Right. Not to obstruct the airway.
Not to obstruct the airway. So that's why the tongue is so important. And actually, maybe those knowledge were lost.
Interesting. So do you recommend any, for example, for patients who, as you mentioned, that you see some of those signs that could point to sleep apnea, and you recommend testing to rule sleep apnea in and out? And sometimes we usually start our screening with a fairly simple questionnaire. It's called Stop Bang, and it's just a very basic questionnaire that it's free. People can take it online, and it gives you a little bit of a score, and based on the score, it gives you a likelihood, either low, intermediate, or high likelihood for sleep apnea. And obviously, it asks about the neck size for men versus women, snoring, and a lot of other things. So are there any specific dental interventions that you find are helpful for sleep apnea patients? Like
I would say a lot of dental intervention can be very valuable for people with sleep apnea. And I'm writing a book about that. I put the dental story into the family drama, because I see these dramas every day in my practice. So dental intervention, but I want your audience to have a clear idea. Dentists can see the sleep apnea sign and can direct you. And I highly recommend you to listen to the dentist, because dentist not the barber / whatever dentist actually see it over and over again. And a lot of patients who I send for sleep study in my practice, they come back with the positive results. What they have, mild, medium, or severe sleep apnea, and they wondering how come they have blood pressure, but doesn't listen to any medications. 1, 2, 3, 4.
Yeah.
Doctor cannot control because of sleep apnea. And some people have atrial fibrillation, and they still didn't have tests for sleep apnea. Now it's getting better, but during my years of treating that, people have atrial fibrillation and they have ablation. Somebody actually touching your heart with a very hot wire, and they still didn't have a sleep study.
Yeah, it's interesting that you mentioned that, because, so atrial fibrillation is a very tricky, obviously, type of an arrhythmia. And there was recently a study, it was a bit of a small study. It was actually done in Prague, but it was the first head-to-head study of ablation versus lifestyle intervention. Now, what was interesting about it is that the lifestyle intervention arm, they received coaching advice, nutritional advice, but they did not use any of those new medications that we have right now, right? GLP-1s, GRAs, like Zepbound and, Ozempic. None of it was used. The study was done prior to the medications being approved. And what they showed is something very interesting, is that of course, the ablation was very effective, but it was effective and more effective than lifestyle in preventing runs of atrial fibrillation that were at least 30 seconds. It was exactly the same between lifestyle and ablation for the overall recurrence of atrial fibrillation, sort of, the coming and going of it. So what the ablation did is just limited or improved this sustained episodes, right? But it didn't really affect how often people were getting them. But what happened with the lifestyle arm is that lifestyle arm, even though they didn't have the newest medications, actually improved cardiometabolically, right? And that was a sustained improvement. While the ablation arm, not only did they not improve cardiometabolically, they actually gotten slightly worse. And so, so this is where I think there is so much impact to be had, because if in the mouse you could see some of those early signs that sleep apnea potentially may play a role, that's also, you're 100% right, that this individual unfortunately has a higher risk of being hypertensive, high risk of having atrial fibrillation. And, an atrial fibrillation is a very serious disorder. There is increased risk of strokes of atrial fibrillation. Obviously, a lot of our invasive procedures such as ablation are being done. So I do think that you're right, that, it definitely is hugely important to have sleep apnea diagnosis. So what is your approach? What do you find the colleagues that you're referring to? What kind of sleep apnea testing they're usually doing? There is a lot of home-based sleep apnea testing now versus sleep centers. Where do you find your patients getting most of these tests?
And most of my patients want to do it at home.
At home.
I do work with a lot of sleep centers over the years, and I understand the value of somebody with comorbidity to have it done in a center. But very often, most of the time, it's extremely hard to fall asleep in a new environment. So, the comprehensive approach of a sleep study in a laboratory, usually the convenience of home when people can sleep longer.
Right, when they're in their natural environment.
So that's, I'm not a sleep doctor, and I'm not the captain of this team. I can only advise things based on my, many years of experience working with the patients. And I think even if they're going to have a sleep study at home and find out the diagnosis, it's a great first step versus nothing.
Right. So how would you, I know that patients have a choice, obviously, when they're diagnosed with sleep apnea. Some patients are advised to go on CPAP or very rarely on BiPAP, but there are also dental appliances for sleep apnea. So
absolutely.
Can you tell us about it?
Obviously I'm a dentist and I'm a big proponent of oral appliance, but I know some of your patients and audience members, they might use a CPAP or they might use oral appliance. I have to advise, but oral appliance, it's not a unicorn. I can do very elegant, almost invisible oral appliance, but in all oral appliances, they do the same thing. They're moving the lower jaw forward. Yes, there are some tongue-based appliances, but it doesn't work in my book. I find I don't find a lot of compliance with that. So I use mandibular advancement device, like I showed to you on the screen. So those devices.
So let's see it again, because some of our listeners, they will be listening to the audio version of this, but this is a good point in the show to switch to our YouTube channel, because what Dr. Maria is doing, she's actually showing you this oral mandibular appliance, which is much smaller than I envisioned it. I thought it was going to be something.
Be bigger. No, it can be bigger. And it depends. Actually, people ask me, how do I choose the design? I use a lot of different design, and I use actually design with a chip for people who are driving planes, buses, trains. They need the report for CDL, or
for
some other thing. For the commissioner. So just like a CPAP, oral appliance can show compliance, and very shortly is going to show also AHI, just like a CPAP machine.
Interesting.
And, oral appliance, I just want to talk a little bit about different types of oral appliance. So it can be with the chip. It also covered by Medicare. That's a very important factor. But this therapy, it's very sad, but it's not so known to the public because a lot of people can benefit from this therapy. It also can be almost invisible, like a clear aligners, but it can also work with orthodontic treatment. And this is another thing what dentists can help patients by moving the teeth, expanding the dental arch, creating more space for the tongue to rest on the roof of the mouth, just like we discussed earlier. A lot of crowding, it's another potential sign of sleep apnea because teeth are actually occupying the same apartment as a tongue.
Interesting. And so I would assume that once actually this crowding is relieved, right, there is a better opportunity for normalization of the oral microbiome. So some of those microbiome species may, kind of disappear or stop taking up residence, right? And a healthier microbiome can emerge.
Yes, absolutely. Your husband educates you so well.
Well, it's it's sort of conversations that we have now and then. So what would you say? Let's first of all, this is great information, and thank you for providing it because like I said, there's so much discussion in medicine and the oral systemic connection, but I think our conversation is giving me some really actionable steps that I think I can
so
patients. And one of the number one reasons, or one of the first actionable step, is really to visit your dentist and to ask these specific questions. Can we do the oral microbiome test? Should I? And we certainly send patients for at-home testing to be assessed for sleep apnea because obviously of its cardiac indications. So there are so many opportunities, and I think one of the interesting opportunities nowadays is that obviously there is a lot of interest right now in longevity. Right. So longevity is making longevity is having its moment. Let's call it this way. Right. There are some interesting books that came out. Dr. Peter Attia came out with his book Outlive. Dr. Eric Topol just published Super Agers. So there's a lot of the interesting books, and personally, I feel that currently a lot of people are looking for longevity in wrong places because they are taking a bunch of supplements, often using hormones, often using peptides. And not that those things are wrong, they're not wrong, but they're missing on the fundamental aspects. Like, is the oral microbiome healthy? Is there any reason to suspect sleep apnea? Is the vascular age okay? I find so many people coming to us who, they look great and they feel great, but then we scan their carotid arteries and there is vascular age is elevated. So the question for you, what do we think about, do these oral bacteria, because there is, it's sort of close together. Is there any evidence to show us that these oral bacteria, sort of the bed bugs, have they been recovered, for example, from carotid plaques? Because I see carotid plaques all the time when I do scanning for our patients for vascular age.
My answer would be yes. And like right now, we also focus on sleep apnea and that part of the connection. But I would say maybe 15 years ago, a lot of dentists try to approach, including myself, try to approach medical community and talk about connection between periodontal disease and cardiovascular health, how the bacteria what resides in a pocket release the toxins into the bloodstream. If your gums are bleeding, that means the bacteria also goes in, or maybe not even specific bacteria, but maybe the toxin. And in my mind, I think body is very smart. As I mentioned before, I'm fascinated with the human body. So I think body work like that. If body doesn't like something, like bacteria, it's going to calcify it. It's going to put it in inside the stone.
It's going to try to control the
try
damage.
to control the damage. And in the mouth, it looks like tartar.
Right.
But inside the blood vessels, it also looks like a plaque.
Yeah, it looks like
but
a calcium
it looks
pore.
like, yes, but it's eventually soft plaque as a reaction to, let's call it calcification of that stuff, become calcified and form the same thing what we see in the mouth. But inside the brain, the same mechanism. It's amyloid plaque trying to control that toxin, what Porphyromonas gingivalis actually release inside. Yeah, so it's not so different, but I see it over and over. People who come to me for sleep apnea treatment, and we evaluate. We usually, before we do this treatment, even if they have their own dentist, we evaluate periodontal health, because I do oral appliance and they actually based on the teeth. So I want to save all the support I have for oral appliance therapy. I would say 95% of the cases, I find periodontal disease. And in the medical history, I find high blood pressure.
Mm-hmm.
Very often I find depression as well. We talk about, stress and, how microbiome can affect your mood and, mental state. But high blood pressure, it's almost often, it's almost 100%, as well as periodontal disease. So for me, I see the direct correlation between periodontal disease and cardiovascular disease. So this is number one, systemic connection in sleep apnea. Number two, systemic connection, but dentist can help you to approach.
Interesting. So this is, that brings up even a whole other area, because, you and I are both women in medicine and dentistry respectively. And we have finally started to discuss in medical circles menopause and implications of menopause for cardiovascular risk, and the view is sort of shifted from, women after menopause have high cardiovascular risk. They catch up in their disease risk to men. The view is shifting to actually being more proactive about it, whether it's with bioidentical hormonal replacement, and of course, control of other risk factors. And I almost feel like, based on our discussion right now, is that, part of that control, part of that preventive longevity strategy should definitely be an oral health or oral systemic health evaluation, because, we know that, women's mouths changes with regard to the hormonal changes and our biochemistry changes. There's weight gain, there's insulin resistance, and I'm sure it certainly leads to some shifts in oral microbiome. So I'm curious if you come maybe across any publications or any information in dentistry which has been relating menopause to the changes in the oral microbiome, because this is where very often, for the first time, we'll see many women perimenopausal, menopausal, become hypertensive, develop labile blood pressure, show abnormal cardiometabolic pattern by blood work, right? And that's in addition to other changes. So has there been any literature, anywhere that says there is an oral microbiome change with menopause?
Number one, I would say, I think it would be wonderful research. But personally, I never come across this particular study, but it doesn't mean what they don't exist. Right. They might be there, I didn't come across. But what I can say about women, and that's what, I learned from writing my articles or from seeing things in the practice. We are amazing creatures. And we have that wonderful hormone called estrogen, and it's actually make us susceptible to temporomandibular joint disorders. A lot of women suffer from that. And in the literature, it's related to estrogen. But on a sleep level, it's exactly vice versa. A lot of women do suffer from sleep apnea, but they don't snore. They show sleep apnea as a depression and anxiety, and they usually give a pill instead of checking the sleep.
Appropriate evaluation, yeah.
But what when I start working with sleep apnea, my idea was what my patient going to be after 40, older than 40, overweight, male. But what I actually see, much younger, fitted females.
Hi everyone, it's Dr. Regina here. Many of my colleagues and I are noticing patients coming to us with self-ordered blood tests. When this trend started to gain momentum, I thought it would benefit many patients. After all, who doesn't want more access to health testing? However, I see that self-ordered labs often lead to more confusion and frustration for our patients. Patients are coming in with a pile of labs, and sadly, they're not better off for it. This is why we at Holistic Heart Centers have launched Heartwell Toolkits, a curated collection of blood and genetic markers that one can get at home, focused on heart and brain health, gives you all the data you need to make informed and actionable health decisions. The toolkits can be ordered at our shop on holisticheartcenters.com. You can find the link in the show notes. Use the code TESTING10 to get 10% off and free shipping. So what is the mechanism then of sleep apnea if they're young and fit, if they're not overweight? What then drives sleep apnea in those patients?
Mouth breathing.
Mouth breathing. And the mouth breathing, would you say that a lot of it could also be environmental, right? For example, dry environment or polluted environment, maybe some toxins like alcohol. What is driving mouth breathing?
Usually what I see is a constricted jaws. That means small mouth and small nose.
So that's anatomy.
That's anatomically, and allergies. Seasonal allergies, let's call it, which I don't know if it's a seasonal allergy or actually immunological reaction to certain food.
Right. So food sensitivity. So I was just about to ask you, because we find a lot that, for example, in our patient experience, we have patients who are doing great, except, for example, elevation of inflammatory markers, right? And I always, of course, point them to go back to their dentist, because if they have, for example, elevated high sensitivity C-reactive protein, very commonly this is gum disease or gingivitis. So I always ask them, go back, get reevaluated, get rechecked to make sure. But we also find that there are some food sensitivities and there's some leaky gut present, and that is driving this, persistent CRP elevations. And the thinking about high sensitivity C-reactive protein also changes, because in cardiovascular trials, typically anything less than 2 is considered to be good. But there is a recent evidence that kind of looked at the bunch of studies in meta-analysis, and it actually established that no, less than 1, and in some situations less than 0.5. That's where you want to be if you want to be called optimal. So I'm wondering whether, as you're saying, food sensitivity, leaky gut, and, toxic exposures that lead to leaky gut, for example, alcohol consumption often leads to leaky gut, even though it could be transient, potentially lead to this, mouth breathing situation. And so what could patients who, let's say you suspect their mouth breathing, is there anything that they can do short of the sleep apnea testing? For example, I heard about technique of mouth taping and things like that. Do they work? What is that all about?
I was just mentioning in the previous, but I did not finish my idea, but oral appliance alone usually doesn't help. We always work with the nose. Nose is a very important organ, just like a tongue. So when I do the therapy, that's why it's called dental sleep therapy, we teach people how to breathe through the nose. And for a lot of people, it sounds obvious, but it's not. People don't even have a clue how they breathe. And we make them aware what, for example, they don't breathe through the nose and keep the tongue on the roof of the mouth, and how to make it happen. So I use a lot of different tricks, we can call it nose cone, or we can call intake. I have a lot of interviews with the inventors of those devices
appliances.
Appliances.
Okay.
Appliances as well, but appliances for nose.
Okay.
And with a special moisturizer. to give people an idea how to breathe through the nose, make them aware what if they use the nose, they're going to feel calm, more relaxed, and they don't have to breathe as often, and actually breathing have to happen with the diaphragm, because most of the time people breathe through the clavicle area, which actually is stimulation of sympathetic nervous system. So we teach these basic signs of survival in our age to add to oral appliance therapy, to make this therapy effective. Because that's first question what I ask people who come to me for sleep apnea: how do you breathe? How do you breathe during the day? Because that's gonna.
I'll bet you most people don't know the answer to that. They
don't know the answer. You're absolutely right,
or something like that. Because I'm thinking, like as you started speaking about it, I'm thinking, am I breathing through my mouth or my nose? I'm not sure. I'm just listening to you right now. Hopefully it's through my nose, but most people. So this dental sleep therapy, Dr. Maria, is it something that a patient? It's like series of exercises that people can do at home, or
usually it's a kind of different stages. So I start with the emergency treatment. That's oral appliance therapy.
That's an oral appliance.
If patients feel the benefits of that and serious about the treatment, we offer them myofunctional therapy. That's a series of exercise, but it's a serious commitment as well, because it's not in a month or in a week. It's at least 6 months, because we need to retrain the connections. We need to retrain the pattern of the basic things of the breathing and holding the tongue.
I see. So that's part of that myofunctional therapy. And so it's basically a structured program to retrain the coordination of the breathing and what have you. So absolutely fascinating. And does it use, do they continue to use the appliance during this myofunctional therapy or no?
That's a tricky question. I do have, just like in medicine, everything works and doesn't work, and you cannot give one answer because it's always dualism.
Right.
So for people who are committed, they definitely improve on a lot of levels, and on a oral systemic connection for sure, because if we are designed to keep the lip closed. Ancient Indian people, it was a tradition, it was a rule, but after the breastfeeding, mom would use her fingers to close the lip of the baby. But right now, who talks about lip closing for the baby?
That's fascinating. So how would, let's say, if someone who is listening to us, one of our listeners, right, if they don't have a dentist who has this skill set, and you definitely have, a very integrative skill set, right? That's why you're here, because we're always, travel in this integrative lifestyle, longevity medicine. How could someone, is there any simple tricks as to how they can assess their breathing pattern to see if it's okay or not okay? Or
Absolutely. I'm going to give you one practical tip. They can drink the water.
Okay.
And hold it for 3 minutes.
So drink the water, hold it in your mouth.
No, get the water and hold it in the mouth.
For 3 minutes. Okay.
And if you cannot breathe through the nose, you're going to spit the water before that.
So
this is a very simple task. Or if you don't want to do the water and you're afraid of drawing, I understand, you can take the balloon and put it in the mouth.
Balloon.
And try to blow your balloon.
I see. Okay. And
because to blow your balloon, you have to breathe through the nose.
Correct. Interesting. So this is a great tip, right? So let me just summarize it for people who are listening to us. Dr. Maria uses a very simple trick. She calls it a 3-minute water test to check whether or not, we are mouth breathing or we are nose breathing. And it's literally involves just taking a gulp of water and holding it in your mouth. You're not swallowing for 3 minutes to make sure that you can actually breathe. Because if you're not breathing through your nose, you'll either swallow your water, you'll spit it out. And that's simple enough. So let's say a person has tried this and they failed a 3-minute test. What is the next step?
The next step, I can say, common way or right way, they have to visit the ENT. But very often when I send patients like that to ENT and ENT look with the scope, they said, you can't breathe.
So ear, nose, and throat doctor.
Ear, nose, and throat doctor usually assess the ability for the air to get through.
Okay.
But I think it's a trainable pattern. And there are, different specialists who can help you to learn how to breathe. How funny it sounds, I don't know. But there are breathing coaches.
Okay.
And I interview a lot of them on my channel. And also myofunctional therapists.
And
that's a different...
And you have a myofunctional therapy resource.
And I have a myofunctional therapy resource in my practice. And that's why if you listeners are willing to go the holistic route, like holistic heart center, to go exactly that route, they can get in touch with me or my office through the Instagram, Dr. Maria Sokolina, or to get on my Facebook group, Sleep Apnea, Breathing, Snoring Help, or, contact me through the website, Dr. Maria Sokolina, or find me, from my office website.
Exactly.
So, and we can direct them. You don't have to be local. There are a lot of people across the globe, actually, what, I'm connected with due to my social media presence, and we can direct you in the right direction, what you learn how to breathe. Because I notice what people who breathe through the mouth, they usually have high blood pressure. And we explained it as a production of nitric oxide, because it's actually produced here and other, in the sexual organs as well, but, equally important, and I'm putting that part in my book, actually. But,
interesting.
Yeah.
So this is fascinating, and I know you are already. So in the show notes, everyone, there is a resource that Dr. Maria generously contributed to all of you that actually talks about myofunctional therapy and retraining. And I think this is such a super important point that, in traditional medicine, we're always looking for something anatomic and not necessarily functional. But for a lot of patients, it's not an anatomic issue, right? They don't have an obstruction in their nose. They just have these abnormal breathing patterns that are not delivering oxygen to their tissues. And of course, as a result, one ends up with chronically elevated cortisol. And very often what we see with this is, of course, hypertension and tremendous cardiometabolic dysfunction. We see insulin resistance, we see obesity, and just chronic inflammation. And that, of course, is the root cause of this oral systemic connection. So, Dr. Maria, it was tremendous to have you. I learned a lot. I am definitely going to ask all of my patients from now on to do a 3-minute test. As a matter of fact, I'm going to do it on myself and report back to in our Holistic Heart University community if I failed or passed. And certainly we will give our listeners access to all of their resources. And they should absolutely reach out to you because you have a very powerful program to help them to retrain themselves for the better. Thank you so much for being here.
Thank you very much. Such an honor to be here. And, just you mentioned about my gifts. I hope my gifts with the video training are free. Can help people
and use advantage of Dr. Maria's free gift. It will be in the show notes so that you can actually understand, how to do this myofunctional therapy and improve your breathing patterns. And that's invaluable. So I will report back once I use it. I will trial on myself. Thank you. Hi to all professionals listening to us today. If you're thinking of launching a cardiometabolic or integrative cardiology program in your practice, we can help. At the Holistic Heart Centers, we help docs in practice to expand into hybrid or concierge services. Head out to the show notes and click on the application link. Your intro call is entirely free.
Ready to schedule a practice review? Use code DOC10 for 10% off our Practice Power Hour 16 minutes coaching session. The link is in the show notes. Thank you for tuning in to Own Your Heart Health with Dr. Regina Druz. This podcast is powered by Holistic Heart Centers. If you enjoyed the show, please rate and review us on your favorite podcast platform. To learn more about our services, visit holisticheartcenters.com and subscribe to our YouTube channel. The link is in the show notes. See you next week.